Good evening to all of you. In this video, I am going to discuss about anti-tuberculosis agents. So, anti-tuberculosis agents are the drugs which are used in the treatment of tuberculosis. If you see the classification of anti-tuberculosis agents, you will find first line drugs and second line drugs and third line. First line drugs are isoniazid, which is denoted by H, rifampicin, denoted by R, pyrazinamide, denoted by Z, ethambutol, denoted by E. So these are the first line drugs which are used in the treatment of tuberculosis. These are continued for the 4 months, 2 months, and then 4 months. Second line drugs under anti-tuberculosis agents are some aminoglycosides. I told you in last videos or last video about aminoglycosides. There is a drugs amikacin, kanamycin, which is used as a second line agents. Another is fluoroquinolones. Fluoroquinolones also we have covered in last videos. Fluoroquinolones are also used as a second line drugs in tuberculosis. The drugs are ciprofloxacin, levofloxacin, moxifloxacin. Apart from that, the drugs which are used as a second line agents are cycloserine, linezolid. So these are the drugs, particularly second line drugs we are using when first line of the drugs are not working in patients, particularly when resistance happens, like your MDR and XDR-TV, extensive multiple drug resistance or extensive drug resistance. In that case, we have to use second line agents. There are some third line agents are also, which third line drugs are those drugs which are not fully established for its efficacy. Vedaculin, rifabutin, these are the drugs which are used in the treatment of tuberculosis. So first drug is isoniazid, that is INH or H we are denoting. It's a well-known drugs and used since 1952 for the treatment of tuberculosis. This drug is bacteriostatic to those bacilli which are not multiplying, and the rapid multiplying bacilli, this drug is bactericidals. Another quality about this drug is this is a isonicotinic acid derivative, and this drug is a prodrug. This drug is you can easily administer these drugs. It's available in the form of tablets, so patient compliance good. It's not expensive as it's available in a generic form, inexpensive, and in children also we can use this drug. In market, this drug is available in various strength like 50, 75, 100, 150, 275, 300, 400 mg tablets maximum. It's available in the market. It's also available in a ampule 50 mg per 2 ml. This drug is you have to be take in the empty stomach. That is an important thing. You have to take this drug in an empty stomach at least 30 minutes before meal or 2 hours after meal. You have to take these drugs for the better absorptions, because this drug is absorbed in a particularly in the acids. In the presence of acid, this drugs is absorbed easily. So you have to take this drug in the empty stomach when acid amount is much more. So you have to take at least 30 minutes before the meal or 2 hours after the meals these drugs. Another points about this drug is contraindicated in the if patient is taking tyramine foods. So the patient could results in cheese reactions, as this drug is also a MAO inhibitors. So you knows what is cheese reactions, and when patient is taking MAO inhibitors and also taking the food in which tyramine amount is much more, so excess of uh, epinephrine or the sympathetic neurotransmitter, which results in cheese reactions. Mechanism of actions of this drug is how it shows the action. As I told you, it's a prodrug and activated by, because it's a prodrug, so it will be activated by mycobacterium tuberculosis catalase peroxidase enzymes. This enzyme is coded with CATG. So this further inhibit the ketoenol reductase, that is encoded by INHA, and this will results in oxygen derived free radicals, formation of oxygen derived free radicals, uh, free radicals like your superoxides, hydrogen peroxides, peroxynitride, peroxynitride, and ultimately kill the bacteria, right? So this is about its mechanisms, and as you know, this drug is metabolized in liver. This drug is metabolism, you know about this drug. It's metabolized in liver through acetylations by N-acetyl transferase enzymes, and these acetylations will depend upon the patients. As you know, some are rapid acetylators, some are slow acetylators. So if there is a rapid acetylator, so in that case you have to use high dose, and there is a slow acetylators, and there is a chances of toxicity of these drugs much more. Another thing is about its ADRs. There is a minor ADRs like epigastric pain, nausea, vomiting will happen after the 2 hours of administrations, and that ADRs can be handled by anti-vomiting agents like metoclopramide, or you can epigastric pains, you can give omeprazole, proton pump inhibitors. Another toxicity ADRs related to this drug is it increases the hepatic enzyme levels, leads to hepatotoxicities, and particularly this drug is more hepatotoxicity if person is alcoholic or any other liver disorders. Another problem with this drug is it will results in peripheral neuropathy. So to reduce this peripheral neuropathy, you can add pyridoxines. You can use pyridoxine. So this is all about first drug, isoniazid. Next video we will discuss about other rifampicins or pyrazinamide. Thank you.